Greetings. Today I'm going to talk about safety and side effects of bioidentical hormone replacement therapy, BHRT. Bioidentical hormone replacement therapy, BHRT, has gained attention as a treatment option for addressing hormone imbalances associated with aging, menopause, and andropause. While many people seek BHRT for its potential benefits, such as relief from hot flashes, improved energy, or enhanced mood, it is important to also understand the potential safety considerations and possible side effects before beginning treatment. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, aka the Nutrition Ninja Doc, founder of MyBodySymphony.com and ARTC.Health. While he continues to research and explore new and better ways to help his patients achieve their health, performance, and appearance goals, I'm here to convey his knowledge and insights about health, healing, and regeneration. Doc Max believes in using technology constructively to improve efficiency and results. That's why he uses this AI-generated avatar to educate and inform. Before we get into it, please leave a like on this video if you find it helpful, and if you haven't already done so, please hit that subscribe button because it goes a long way toward helping spread these health-related presentations to more people. Understanding BHRT, BHRT uses hormones that are structurally identical to those naturally produced by the human body. These compounds are often derived from plant sources and can be provided in forms such as creams, gels, patches, pills, or injections. Some formulations are FDA approved, while others are prepared by compounding pharmacies to meet individual needs. Although bioidentical suggests a natural fit with the body, it does not mean the therapy is free from risks. As with any hormone treatment, the effects can vary depending on personal health history, dosage, and method of administration. That is why proper supervision from someone experienced in BHRT is vital. Potential side effects. The side effects of BHRT may be similar to those experienced with traditional hormone replacement therapies. They can range from mild to more serious, and not everyone will experience them. Possible side effects include weight changes or bloating, mood swings or irritability, acne or oily skin, breast tenderness, headaches or migraines, changes in sleep patterns, increased facial or body hair with testosterone therapy. In some cases, improper dosing can lead to excessive hormone levels, which may heighten these side effects. Regular monitoring through lab tests is essential to ensure hormone levels remain balanced. Safety concerns. While BHRT may help many people, there are safety concerns that should be carefully considered. Cardiovascular risks. Hormone therapy may influence heart health, including risks for blood clots, stroke, or high blood pressure in some individuals. Overall, however, the research indicates that BHRT is quite beneficial to cardiovascular health. Cancer risks. Estrogen and progesterone therapies, if not properly balanced, may affect the risk of certain hormone-sensitive cancers such as breast or uterine cancer. Even this is coming into question since using bioidentical hormonal therapy actually supports the immune system and reduces cancer risks. Liver health. Oral hormone therapies can sometimes affect liver function. This is mainly with oral forms of testosterone or estrogen due to first-pass metabolism by the liver. Regulation differences. FDA-approved bioidentical hormones undergo safety testing, while compounded formulations may vary in consistency and quality since they are customized for individuals. Most knowledgeable practitioners prefer compounded versions. Safe use of BHRT. The safest approach to BHRT involves comprehensive evaluation, blood tests, and health screenings before starting therapy. Personalized dosing. Tailoring treatment to individual hormone levels and adjusting as needed. Regular monitoring, ongoing lab tests and medical check-ins to track hormone balance and side effects. Professional guidance, working closely with a qualified healthcare provider experienced in hormone therapy. Conclusion. Bioidentical hormone replacement therapy can provide relief from symptoms of hormonal imbalance, but it is not without potential side effects or risks. Understanding these potential concerns and working under medical supervision is key to safe and effective treatment. With proper monitoring and individualized care, many people find BHRT to be a helpful part of managing health changes related to aging, menopause, or andropause. As always, please reach out for information on our personalized health enhancement and age reversal programs, including bioidentical hormone replacement and peptides 941-806-5511.